Hi ladies, we are today back to talk about coronavirus again. So today we will try to answer questions. What effect does coronavirus have on pregnant women? Generally, pregnant women do not appear to be more likely to be seriously unwell than other healthy adults if they develop the new coronavirus. It is expected the large majority of pregnant women will experience only mild or moderate cold flu-like symptoms. More severe symptoms such as pneumonia seem to appear to be more common in older people, those with weakened immune systems or long-term conditions. As yet, there is no evidence that pregnant women who get this infection are more at risk of serious complications than any other healthy individuals. If you think you may have symptoms of COVID-19, you should use, if you are in UK, the NHS 111 online service for information. What effect will coronavirus have on my baby if I am diagnosed with the infection? This a very new virus. As this is a very new virus, we are just beginning to learn about it. There is no evidence to suggest an increased risk of miscarriage. Initial reports from China showed no evidence of the virus passing from the mother to the baby during pregnancy or birth, vertical transmission, However, on the 26th March, new information was published. In one case from Wuhan, there is stronger evidence that vertical transmission may have occurred. This clearly requires further investigation, and the RCOG is carefully monitoring all evidence as it is produced. It is important to emphasize that in all reported cases of newborn babies developing coronavirus very soon after birth, the baby was well. Given current evidence, it is considered unlikely that if you have a virus, it would cause problems with the baby's development, and none have been observed currently. Some babies born to women with symptoms of coronavirus in China have been born prematurely. It is unclear whether coronavirus caused early labor or whether it was recommended that the baby was born early in order to preserve the mother's health. The UK is conducting near real-time surveillance observation of all women who develop COVID-19 during pregnancy and their newborn babies through well-established systems already used by all maternity units. We will update our information if and as soon as there is any change in the evidence. What can I do to reduce my risk of catching coronavirus? The most important thing to do is to follow government guidance for pregnant women and the rest of the household. This includes regular hand washing. First of all, regular hand washing. Use a tissue when you or anyone in your family coughs and sneezes. Discard this and wash your hands. Avoid contact with someone who is displaying symptoms of coronavirus. These symptoms include high temperature and/or new and continuous cough. Avoid non-essential use of public transport when possible. Work from home where possible. Avoid large and small gatherings in public spaces. Nothing that pubs, restaurants, leisure centers, and similar venues are currently shut as infections spread easily in closed spaces where people gather together. Avoid gatherings with friends and family. Keep in touch using remote technology such as phone, internet, and social media. Use telephone or online services to contact your GP or other essential services. Why are pregnant women in a vulnerable group? Pregnant women were placed in a vulnerable group by the officials, the chief medical officer, on 16th March. This means you have been advised to reduce social contact through social distancing measures. Based on the evidence we have so far, pregnant women are still no more likely to contact coronavirus than the general population. What we do know is that pregnancy is a small proportion of women can alter how your body handles severe viral infections. This is something that midwives and obstetricians have known for many years and are used to dealing with. As yet, there is no evidence that pregnant women who get coronavirus are more at risk of serious complications than any other healthy individuals. What has driven the decisions made by officials to place pregnant women in the vulnerable category is caution. We know that some viral infections are worse in pregnant women. At the moment, there is no evidence that this is the case for coronavirus infection, but the amount of evidence available is still quite limited. We go further. What do I need to do now? As a precaution, you should follow government advice about social distancing. Stay away from public places and avoid anyone who has symptoms suggestive of coronavirus. If you are in your third trimester, more than 28 weeks pregnant, you should be particularly attentive to social distancing and minimizing any contact with others. Okay, coming question. Should I attend my antenatal and postnatal appointments? Of course, yes. It is really important that you continue to attend your scheduled routine care when you are well. Maternity care is essential and has been developed over many years to reduce complications in mothers and babies. There is a potential risk of harm to you and your baby if you don't attend your appointments, even in the context of coronavirus. If you are well, you should be able to attend your antenatal care as normal. If you have symptoms of possible coronavirus infection, you should contact your community midwife to postpone routine visits until after the isolation period is over. At this time, it is particularly important that you help your maternity team to take care of you. If you have had an appointment cancelled or delayed and are not sure of your next contact with your maternity team, please let them know by using the contact numbers given to you at booking. The following practical advice may be helpful. Listen, if you have a routine scan, appointment or visit due in the coming days, please contact your maternity unit for advice and a plan. You will still need to attend, but the appointment may change due to staffing requirements. Some appointments may be conducted on the telephone or using video conferencing, provided there is a reasonable expectation that observations such as blood pressure or other tests are not needed. The recommendation that your pump will be measured from around 26 weeks of pregnancy should be observed by your maternity team unless you are in the recommended 14-day self-isolation period. If you are between appointments, please wait to hear from your maternity team. If you are attending more regularly in pregnancy, then your maternity team will be in touch with plans. If you miss an appointment and haven't heard from your maternity team, please contact them to rearrange the appointment. Whatever your personal situation, please consider the following. If you have any concerns, you will still be able to contact your maternity team, but please note they may take longer to get back to you. If you have an urgent problem related to your pregnancy but not related to coronavirus, get in touch using the same emergency contact details you already have. Please do not contact this number unless you have an urgent problem. If you have symptoms suggestive of coronavirus, contact your maternity services and they will arrange the right place and time to come for your visits. You should not attend a routine clinic. You will be asked to keep the number of people with you at appointments to a minimum. This will include being asked to not bring children with you to maternity appointments. And on occasions, your maternity unit may request that you attend your antenatal appointment alone to aid infection control and help keep staff safe from transmission. There may be a need to reduce the number of antenatal visits. You will be told if this is necessary. Do not reduce your number of visits without agreeing first with your maternity team. Okay? Is that clear? What is the travel advice if I am pregnant? If you are in the UK, you should follow the advice given by the Foreign and Commonwealth Office, which is being regularly updated in line with the evolving situation. All individuals, including pregnant women, should ensure they have adequate insurance arrangements prior to travel. You should also check that your travel insurance will provide cover for birth and care of your newborn baby if you give birth while abroad. What impact will coronavirus have on my pregnancy? The NHS in UK is making arrangements to ensure that women are supported and cared for safely through pregnancy, birth, and the period afterwards during this pandemic when there will be extra pressures on healthcare services. Maternity services are absolutely essential and the RCOG is helping units to plan, have to staff obstetrics and gynecology services to ensure safe care is provided. This includes reducing staff commitments outside maternity units, reducing any non-essential work within trusts, and reorganizing staffing in obstetrics and gynecology services. Okay. Maternity units are increasingly providing consultations on the phone or by video link when this is appropriate, so you do not have to travel unnecessarily to the hospital. However, some in-person visits with a midwife are essential, and it is important for the well-being of you and your baby that you attend these to have routine checks. Routine gynecology operations are being postponed, and in many units, arrangements are being made for gynecology doctors to work in the maternity unit. Will my childbirth choices be affected by the coronavirus pandemic? Will my childbirth choices be affected by the coronavirus pandemic? We understand this must be a stressful and anxious time if you are pregnant and due to give birth in the coming months. Maternity units everywhere are working around the clock right now to manage additional pressures and facilitate women's choices. Like all areas of NHS care, maternity services will be affected by the pandemic, but units are working to ensure services are provided in a way that is safe, with the levels of staff that are needed and the ability to provide emergency care where necessary. If you have chosen to give birth at home or in a midwife-led unit that is not co-located with an obstetric unit, it is worth nothing that these services rely on the availability of ambulance services to allow for rapid transfer to hospital and the right number of staff to keep you safe. If these are not in place, it is possible that your trust or board may not be able to provide these services. Will I be able to have my birth partner with me during labor and birth? Will I be able to have my birth partner with me during labor and birth? Of course, yes, of course. You should be encouraged to have a birth partner present with you during labor and birth. Having a trusted birth partner present throughout labor is known to make a significant difference to the safety and well-being of women in childbirth. If your birth partner has symptoms of coronavirus, they will not be allowed to go into the maternity suite to safeguard the health of the women and the maternity staff supporting you. Local trusts may place restrictions on visitors, which might mean that partners are not able to attend routine antenatal appointments or stay with women in antenatal or postnatal wards. However, this should not impact on your birth partner's presence during your labor and the birth, unless you are unwell. Let's keep up.